We are living in the most technologically advanced era of healthcare in human history. More scans, more specialists, more information than ever before. Yet often, care still feels fragmented. Outcomes are inconsistent. People are left confused about what's happening in their own bodies. Different specialists give different information, not because anyone is wrong, but because each is seeing only part of the same system. The current framework is incomplete. We are missing something essential in the way we are looking. We are missing something essential in the way we're being taught, and we are missing something essential in the way that we're practicing medicine. That thing that's missing in the human body is a system of interstitial intelligence that links everything to everything else. There's lots of speculation as to why we're missing this system. One of the leading theories is because it doesn't show up on any form of imaging. Not on X-ray, not on CT scan, and not in the gold standard of MRI. Fascia does not consider the body in isolated parts. It is a three-dimensional, interconnected web that surrounds our entire body from head to toe, in to out, out to in, up to down, and down to up. I've been practicing as a physical therapist for the last 15 years. 15 years of practice equates to about 30,000 hours of practical application in studying the human form. Over the past 4 years, 8,000 of those hours have spent directly with hands-on human bodies. When we approach the body with force, it reiterates dysfunctional patterns. In 2021, I was introduced to myofascial release as taught by physical therapist John F. Barnes. Since then, I've immersed myself in the learning and practice of this technique, and I apply it in my practice every day. These principles can also be applied in life. It teaches you to approach slowly, sink in softly, and wait at the barrier. Current evidence is emerging, the most comprehensive body of evidence, under the purview of Dr. Jean-Claude Gimberto, who has studied comprehensively this system in situ in vivo, meaning in place, alive. The current model teaches students to learn about the body through the dissection of cadavers. We can liken this practice to understanding a living tree by looking at a fallen log. The work of Dr. Jean-Claude can be found on YouTube, called Strolling Under the Skin, or at the website endovivo.com, where he has over 1,500 clips and videos of living fascial tissue. The fascial system is in constant flux. It's moving all the time. It can separate, divide, bifurcate, triplicate. In practice, what we see are people who have been through the system for months, for years. Temporary relief, cyclical presentation. Oftentimes the pain returns, sometimes somewhere else entirely. Fascia responds to stress, tension, time, and emotion. All of our bodies retain our story over the course of a lifetime. Sometimes that story starts before we're even born. Sometimes that story is not even yours alone, as some of these can carry through generations. You can picture a silhouette of the human body and imagine any event over the course of your life that has ever caused inflammation, injury, illness, infection, surgery. emotional trauma. It would be as if striking that silhouette with a paintball anywhere one of those events ever happened. You can see where the strike occurred, the epicenter of the restriction, and you can see where the sprays go out. Eventually, as we accumulate these events over the course of a lifetime, the sprays start to overlap one another, and those traumas get embedded deeply within our tissues. One thing that we have to understand about all of this is that we need a new understanding. We need to stop looking at the body in isolated parts, and we need a framework that looks at it as a continuous whole. Oftentimes, someone like me is a last stop in someone's journey of healing. What if this could be different? What if fascia became a first stop? What if chronic pain became understood as unresolved communication? What if stress patterns become understood as adaptive intelligence? Currently, fascia is getting a lot of lip service on social media platforms. Unfortunately, my belief is that this is doing a big disservice to legitimate fascial education and research. A lot of what's being produced and released online isn't so accurate, or it's only a small piece of the whole picture. We need to start paying attention to the legitimate fascial research that's going on. And this is not new. This has been around for decades. When we start looking at healthcare through a fascial lens, we're seeing improved outcomes, reduced pain, restored motion, and a general improvement in the overall quality of life. Symptoms that have been present sometimes for decades start to soften, sometimes go away completely. Outcomes that patients have been told by their physicians will never change, or they will just have to get used to, or will always be present, resolve. Not in all cases. There's a variation of response, as with any other intervention. But the terms always and never have no place in the practice of healthcare. When we start addressing fascia first, patients become actively engaged in their own medical outcomes. They return to a life full and well-lived. We don't just see a reduction in symptoms. We also don't just look at those symptoms differently. We can potentially change the entire trajectory of care. Treatment starts with a whole person assessment. We're looking for any misalignment. Nitpicking. You'll find crowds within the therapy sectors that suggest posture is not so important. And there are times when it's not. But if you were purchasing a home and that home was off its foundation by even just a little bit, that would not pass inspection, and they would not allow you to purchase until the issue was corrected. Now, with posture and misalignment, what we're coming to understand is that when structures are out of alignment, such as the pelvis being rotated by even a millimeter, which is a grain of salt, it will pull everything above and everything below. And not only is that impact seen at the pelvis or in the extremities, it affects the cranium and the jaw. Many times practice when you come in, if you're with shoulder pain or knee pain or back pain, that's where the focus of treatment is going to be. But pain doesn't present where the problem starts. Often, the problem starts where the body lost its ability to adapt. The body brilliantly compensates until it can't anymore. Introducing a framework such as this into the current educational model would really not be that difficult. It would require a small shift in textbooks, in teaching, and in viewing the body. It's too bad there's not a large research institution around here. But honestly, there's no sector of healthcare that would not benefit from increased knowledge of fascia and application of fascial literacy and techniques such as myofascial release. If athletes knew what myofascial release could do for athletic performance, there would be one in every single training room across the country. If children were treated with myofascial release when they were first born, we could potentially change an entire generation of healthcare outcomes quickly and easily. There are already over 100,000 myofascial release therapists trained worldwide. And there are other groups of fascial-specific, fascial-educated therapists, educators across the world. One thing that makes fascial treatment and knowledge so easily applicable is that it can be used with almost any person in almost any circumstance under some capacity. And the worst possible outcome is that you don't see the results you're hoping for. And while that might not be ideal, it certainly isn't sinister. So instead of waiting until after prescription medication, after surgery, and after spinning wheels through multiple diagnostics and multiple follow-up visits, there's truly no reason not to address the fascial system first. We are missing something essential in medicine, and that needs to be addressed. Thank you.